O médico Farrukh Hussain é o chefe do Cardiac Cath Labs do William Osler Health System e tem vasta experiência na cardiologia. Mais de 60 mil canadianos por ano sofrem o seu primeiro infarto e isso tem sido motivo de grande preocupação para os especialistas. Para controlar este problema, o Dr. Hussain dá-nos 5 dicas importantes. Hello, thank you for accepting to come.
Thank you, Helena, for having us and educating community. Thank you.
So, let's start with the first tip, which is related to a health diet. So, what ingredients promote a healthy diet?
Helena, I think one of the most important things is, we have very multicultural community in Peel in our region. So we have access to a lot of good foods from a multiple amount of cultures.
And delicious.
Very delicious. That's the good and the bad of it. It's the good because of the taste, but bad because we have access to them. One of the best data for the best kind of diet long-term for heart disease, at least prevention, has been something called a Mediterranean or a plant-based diet. The focus of that diet generally is inclusion of large amounts of vegetables, fruits, beans, legumes, lentils, fish, olive oil, nuts, and berries. That comprises about 90-95% of the diet, along with whole grains, so complex carbohydrates, not necessarily the simple ones, which we often prefer to eat, the fried stuff. So things to avoid would be things like sugary foods, processed meats, processed foods, canned foods, those kinds of things, generally avoid those. Anything sweet or simple carbohydrates, the red meats, other meats that are prepared, those are things to avoid. So in English, just focus on those 7 things is what I like to tell my patients, which is vegetables, berries, nuts, olive oil, legumes, lentils, beans, fish, and olive oil. Those comprise the majority of what a Mediterranean diet is. We know from good data that that can reduce the onset of heart disease and also may reduce other types of disease such as cancer down the road. But the data is very strong for heart disease that we know that we do well when we include those things in our diet.
And sounds delicious anyways.
It is classically Mediterranean, very appropriate for our community.
So secondly, smoking and vaping. How do they affect the heart?
So what we do know is if someone is smoking at any level, smoking is bad. That's very clear. So smoking cessation should be one of the major focuses of our healthcare system and our community. So it's imperative to stop smoking entirely and stop vaping entirely as well. We know that ongoing smoking can increase the risk of heart disease, heart attacks by at least 2 to 3 times, and in some studies more than that. We know that even 20 minutes after stopping smoking, 20 minutes, your heart rate and blood pressure already decreases. Within a day or 2, you can have other parameters that improve. And by a year of stopping smoking, you can actually go back to having risks of heart disease of people who don't smoke. So you can make big changes if you do it today. So contact the Smokers Helpline, call 811, call the Center for Addiction and Mental Health, look them up on the internet. These are many resources the community has to look up and get help for smoking cessation and vaping cessation. Vaping is not necessarily a lot better. In some studies, it might be a little bit safer, but it's overall still causing lots of bad things for the lungs and the heart and possibly oncology or cancer as well. So it's very important to stop smoking. And resources that the community can use is Smokers Helpline, Center for Addiction and Mental Health, and as well as call 811. And Ontario Helpline can also help with speak to your physician, more importantly. If you have a physician, please speak to them. There's many medications that can be used, such as nicotine patches, varenicline, Zyban, that can help you to quit smoking as well.
What other risks should we be aware of?
I think the first thing to be aware of is prevention is the key to heart attack or heart disease prevention. So one of the things is, as you know, by age 40, we should all be screened for diabetes, cholesterol, blood pressure. If you smoke, stop smoking. Family history is genetics. We can't change what we get from above, but we can be aware of those risks. Increase activity level slowly, mild to moderate activity, as well as losing weight. But the most important things is to go to your physician and get screened between the ages of 20 and 40. So let's say if you have a family history of heart disease, which is generally a man under 50 to 60, women under 60 to 65 of having had a heart attack or stents or bypass in the family, go to your family doctor, get screened for diabetes, cholesterol, blood pressure, and treat those early. The earlier we treat the risk factors...
We should start doing those things very early, I think.
Absolutely correct, Helena. Absolutely correct. So the earlier, 40 is the minimum basic that we should screen at. If you have any of those risk factors or a family history, please go to your family physician and get those risk factors screened much earlier so they can be treated much earlier, so you don't need the healthcare system as much. And prevention is, trust me, coming from a person who puts in stents for a living, prevention is much more helpful if you can do that. The other thing to know for risks is activity levels. For instance, we had a snowstorm 4 weeks ago. The risk of heart attacks can rise a lot. So activities such as shoveling, excessive gardening, hockey. So sudden changes in heart rate and blood pressure, sudden changes in heavy activity can set off heart attacks. So it's very important to start off by speaking to your family doctor before starting an exercise program or doing heavy activities such as this, because they can definitely increase your risk of heart attack. So know your risk as far as risk factors, and then moderate activities, start slowly if you will do those activities.
Can you speak to the importance of recognizing the signs of a heart disease?
The major thing in our community is we don't have as much education to recognize when you are having a heart attack. So some of the signs to know for a heart attack can include chest heaviness, chest discomfort, burning in the chest, arm discomfort, throat tightness or discomfort, even jaw discomfort, excessive sweatiness, excessive fatigue, palpitations, lightheadedness, nausea, vomiting. Any of these symptoms, please call 911 early. Do not wait at home with these symptoms. You could be completing a heart attack at home. The faster you present to us, the better the outcome will be. If you come to us late, we can make small differences at that time, but we can make a much larger difference if you come in early by calling 911, come into the hospital. If you have a blocked artery, we can take you to the angiogram lab and open the artery with a procedure called angioplasty and stents, and save a lot of heart muscle. The key word that we have in our line of work is time is muscle. The longer you stay at home, more of the heart muscle is dying with the heart attack. The earlier you come to us, we can open it earlier, save muscle, and improve your outcome in the long term and short term, both. So the important thing is remember the symptoms: chest heaviness, arm discomfort, throat discomfort, nausea, vomiting, sweatiness, dizziness, palpitations, shortness of breath. If you have any of those symptoms, please call 911 within minutes and have the EMS evaluate you. And if they think you're having a heart attack, they will call the hospital or call us, and we can help. We're there 24/7 to help if you need.
Most of us are familiar with the importance of a CPR.
Yes.
With or without formal first aid training.
Yes.
Can you give us a quick refresh?
Sure. First, I'll set up the scenario of why we need this. What we're looking at is the problem of something called cardiac arrest. Cardiac arrest is a situation. Some people mistake a heart attack for cardiac arrest. They're very different. One can be caused by the other. Cardiac arrest is when the heart activity stops, whether that's due to an electrical problem, such as what we call ventricular fibrillation, when the heart's not working, or other types of electrical problems of the heart, or functional mechanical problems of the heart that can cause the heart to stop. When the heart stops, the brain doesn't get flow, we often become unconscious. The chances of surviving something like that are well under 10% in the community. So it's very important to have techniques that we can use to help in any way possible to help those people have slightly better chances of survival. One of the causes of a cardiac arrest is a heart attack. There's many others, but one of the common one is a heart attack. So what we are trying to promote in the community is learning CPR. It's called hands-only CPR. So we want to make it as simple for the community as possible. So if you have someone unconscious or passed out, the first thing is to do is nudge them and say, "Are you okay? Are you okay?" If they're not responding, the first thing you do is call 911 immediately. Put the phone beside you, talk to the operator. While you do that, you can find the middle of the chest here. Put your hands in this position. Put that in the center of the chest. and compress as hard as you can, 2 to 2.5 inches, 100 to 120 times a minute, as fast and as hard as you can. If the patient is awake, they will push you away, of course, but most of the time they're not. Some of the concerns that the community has is, am I going to hurt? Am I going to break ribs? You have to remember that that person is dying. If you do nothing, they will pass away, or they will have irreversible brain damage. So by doing something, you increase the chances of survival by 2 to 3 times. So they may not necessarily survive if you do that, but you give them a fighting chance. And the chances of doing anything bad are quite low to that person. So you should learn. Please go to Red Cross site, St. John's Ambulance. If you have the time, please learn formal CPR, but at least try to learn hands-only CPR, which can sustain life or at least improve the chances of that person's survival to get to the paramedics. You continue to do that CPR till the EMS team arrives and they can take over the care of the patient for you. But it is critical that our community learn hands-only CPR. Just to give you a quick overview of what's happening in our region, we represent about 1.3 million people at Osler in our catchment area. Our area represents, as of 2015, 14% of the cardiac arrests in the province. So we represent about 1/15 of the population, and yet we represent 1 in 7 of the arrests. Our cardiac arrest rate in our population is double everyone else's in the province, even our neighbors to the south and north. Our rate is double. So it's even more important for our community to learn the skill, which is free, low risk, and you can help. The last thing, 75 to 80% of cardiac arrests happen in the home. So by learning this simple thing, you will help your own family and friends rather than watching them pass away. So please, I urge you to learn hands-only CPR if you can.
Thank you. Let's finish with a message to our viewers who wants, for sure, to have a healthy heart.
I think there's a few messages, but it's a combined message of the 5 tips. Change your diet, if you can, to a Mediterranean diet. Stop smoking. Take up mild to moderate activity after consultation with your physician. Avoid extremes of activity such as shoveling or heavy yard work and so on. The last thing, learn CPR to help make those big changes in our community or little changes. And please have your risk factors screened. Diabetes, high blood pressure, cholesterol. Our community has extreme rates of diabetes in our region. So have those screened with your family physician, and also learn the signs of the heart attack. Recognize the heart attack, what we talked about, and come in early. Do not stay at home completing your heart attack. Call 911. That is the single best message I can give you today, is call 911 if you have the symptoms of a heart attack. Please come to us. We are available. Don't stay at home. Thank you,
Thank
Helena.
you so much,
Thank
Doctor.
you, Helena. Appreciate it.
It
Thank you
was
so
a
much.
pleasure to have you and learn all these important tips.
Thank you,
Thank
Helena,
you so
for
much.
educating the community. Appreciate it very much.